Hi, everyone. I'm Madeline Heim, Health and Science reporter for the Post Crescent and USA Today Network Wisconsin, and we are back for another Newsmakers Coronavirus Edition. As the pandemic has unfolded, I've been really lucky to hear from a lot of perspectives on it, from state health officials to epidemiologists to people who are making the ingredients for testing. But as I was thinking about who to bring on the show this week, I thought that one perspective that might have been missing so far was, that of a healthcare worker, someone who is quite literally on the front lines in the hospital. So today, I'm really excited to have as my guest Adam Rockman, a nurse supervisor who is caring for COVID patients in the ER and ICU at Bellin Hospital in Green Bay. And, especially given that at one point the coronavirus outbreak in Brown County was one of the fastest growing outbreaks in the country, I'm really eager to hear about how you dealt with it. So without further ado, we will dive in. And Adam, I just wanted to start with some basics, first of all. I'm wondering, how long have you been a nurse and why did you want to go into nursing in the first place?
So this is actually a second career for me. I used to sell motorcycles before, if you believe that. I've been a nurse for about 8 years now. And what happened was the place I was working at ended up going out of business, and I needed something else to do. And I wanted to do something that I could really make a difference in people's lives and feel like I was doing something important. And nursing seemed to be one of those things where there's a lot of different opportunities to do a lot of different things, and it really interested me.
Yeah, absolutely. And so just to kind of gauge a little bit about what your job looked like before the pandemic and, how much things have changed essentially for you. I'm just wondering if you could talk a little bit about what your day-to-day looked like prior to COVID-19 and then what it looks like now. What are the biggest differences that you've seen?
Sure. Well, a lot of the stuff isn't terribly different for us because I work in an ICU primarily, and a lot of those people are still sick. So the people that come into the ICU with big infections or heart attacks or strokes or those kind of things, those things are still happening. So we still see a lot of those patients. So a lot of that stuff is kind of the same. What ends up being different is the COVID stuff, and we had to kind of rework a lot of our workflows for that. At Bellin, we dedicated an entire floor to be kind of our isolation floor to make sure that we had the capacity to take care of these patients safely, not only for the patients, to make sure that we weren't cross-contaminating and getting people infected with the virus that weren't infected when they came in, but keeping healthcare workers safe too. So the focus on PPE or protective equipment for healthcare workers, I'm sure everyone's very familiar with. It's been in the news quite a bit. We're fortunate where we have a pretty good stock of PPE, so we're not running into shortages. We're using it differently than, we've been taught to use it for years and years and years. So that's kind of different. A lot of the things that we've been taught to use as single-use items, we're finding that we don't have enough to use them as single-use items, so we have to find a way to kind of reuse those things.
Yeah, definitely. I have heard a lot about that. And, I've heard too about, how long it takes to put on full protective equipment before you have to go into a room that, previously you could just walk right into a patient's room and now there's a whole bunch of steps. Is that something that you found as well, I'm sure?
Yeah, definitely. And we really tried to address that when we set up our isolation ICU. So a lot of our ICU is where we're in the PPE for the vast majority of the time. So if there is an emergency with a patient, we don't have to be gowned up because we are, gowned up. We have our respirators on, that kind of stuff. So we're able to respond in a more timely manner. It's probably a little more cumbersome for us because we're in that gear for the entirety of our 8 or 12-hour shifts. But for the patients, it ends up being better because we're able to respond in a lot faster manner.
Yeah, definitely. That makes a lot of sense. So yeah, I've just been thinking a lot about how, just 2 or 3 months ago, this all felt, pretty distant and, we knew about the virus, but it didn't seem like it was here yet. And, even when it was here, it, didn't seem like it was going to be quite as crazy as it is now. And, most people weren't really thinking about hospitals possibly becoming overwhelmed. So I'm wondering, was there a moment or, a couple moments for you when you realized that this is going to be more dangerous or a bigger deal or have a bigger effect on people than we initially thought? And what was that moment?
Yeah, I think there were a couple things that kind of hit me. And the first was when this kind of all started. and we started kind of suspecting that patients were going to be presenting with these things and how we were going to deal with them. And at that point, we hadn't gone to the extent of setting up an isolation unit or anything like that. We had just put them in our regular isolation rooms on the floor. And we had a particular patient that was a rural patient, and we ended up having to, do a lot of interventions in the room and having a lot of staff in that room at the same time, and realizing how much equipment you're really going to need to be able to take care of these patients and how much preparation you're going to have to do to make sure that the system is set up to have the ability to take care of those patients safely. So some of those initial experiences kind of drove what we ended up doing at Bellin to make it safe for the patients and the staff to take care of those patients.
Yeah, definitely. Yeah, I can imagine that. Obviously, as no one in the world expected what this, or no one knew what this virus was going to do. So I can imagine that those early times were definitely challenging. And so sort of in that similar vein, just thinking back about the last couple months, I'm wondering, what are some of the most, maybe intense experiences or experience that you feel will stick with you for a long time, that you've had while working during the pandemic?
I think one of the most kind of personal hit home kind of things was when I had to explain to my 9-year-old that he can't hug daddy when he comes home right away. So I kind of have a routine that when I come home from work, I have an area set up in the garage where I take all my clothes off. I come in the house, I jump in the shower right away, and kind of make sure that I'm not bringing any of this stuff home to my family, and being able to explain that to, your kids who want to, they're excited to see you and they want to give you hugs right away when you come in the door, and be like, you can't do that right away. I guess that was the thing that hit home the hardest.
Yeah. I've just, in other things that I've been reading about healthcare workers, that definitely seems to be a common thread, and I just can't imagine it. So yeah, that definitely makes sense that would be quite intense to deal with. And I'm wondering also, so obviously you're wearing a lot of PPE back, when you're treating the patients. And I'm wondering how your relationship with your patients is different now from before. Does the PPE make it feel less personal, like they can't really see your face or see you, or does it feel more personal because, obviously their family can't be there with them, and so you're sort of, one of the only people who's able to see them?
Yeah, I think you can kind of take it both ways. Kind of like you said, because there's no visitors and there's no family there, there is kind of a sense of being alone for the patient. So we've done a lot of things to try and kind of help with that by bringing in means of like video chat with the families and those kind of things, which kind of helps. But as far as the relationship with the patients, when we're taking care of patients, we're fortunate where we have a lot of the PAPRs, which are the big hoods that you see people wearing with kind of the backpack kind of thing that blows fresh air into them, which are fantastic, and they're very protective for us. But you've got a big shield in front of you, you've got air blowing into your face, and it's hard to communicate with patients sometimes. It's not always the easiest to hear, it's not always the easiest to be heard. So that presents some unique kind of barriers that we didn't have to deal with before.
Yeah, I can imagine that, and especially for a patient, if they're really ill, coming in and seeing that might be a bit of a shock, but definitely necessary, of course. And so, yeah, that makes sense. And also, I'm wondering about, how worried you are personally about getting the virus, and, have any of your colleagues been ill, and, how do you deal with sort of that element of it, as well as just, I could get this virus just as easily as anyone that I'm treating.
Right. And that is scary. And I kind of told you about what my routine is when I come home from work. And I think that kind of shows the concern that we do have as healthcare workers for this, and the respect that we do have for it, not wanting to bring it home to our families or catch it ourselves. As far as my coworkers being sick, there've been a couple that have contracted the virus, but no one's been terribly ill with it, which is fortunate. We do a really good job of trying to keep our patients, not only our patients, but our staff safe with appropriate PPE, and making sure that we're not putting employees in a position where they're more at risk. even the staff that aren't taking care of these patients, like we wear masks all the time. We wear eye protection when we're with patients. So we do a lot of stuff that's maybe above and beyond what would need to be done just to kind of ensure our safety.
Yeah, absolutely. And then, so just backing up a little bit to, you're talking about getting home to see your family, and obviously that's, a sacrifice to not be able to hug your kids right away. And I'm just wondering, what other sacrifices do you feel like you've had to make during this time that come from just being in the hospital and being a healthcare worker during this time?
Sure. And I think a lot of the sacrifices that we make are the same sacrifice that everyone's making. We don't get to see extended family. I've got a 9-month-old at home right now, and he hasn't been able to see his grandparents for like 3 months. And they were here quite a bit before. Not being able to go out and do the normal things that you do. It's starting to get nice out now, and people are wanting to do more things, and having to kind of rein that back and kind of look at everything that's going on. I think a lot of people are making sacrifices, and we know that this isn't super fun and no one likes doing it, but at the same time, it's important to do.
Yeah, definitely. And, just looking at all of this craziness that has unfolded in the past couple months, obviously this is something that is going to stick on everyone's minds for a really, really long time. But, specifically from the perspective of someone who's working in the hospital, just wondering, how has what you've seen and what you've had to go through during this time, changed you, maybe professionally or also personally?
Sure. I don't know. I feel like in this profession, you deal with a lot of bad things. You deal with, like I said, we deal with people on their worst day a lot of times, and you got to kind of take that into account when you're taking care of people. But at the same time, we get to see a lot of really good things too. We get to see people recover, and we get to help a lot of people and change lives in that manner. So I don't know that any of that's necessarily like changed. I mean, it's different now. The way that we take care of these patients, not having family there is different. So we have to be more of a support for our patients, because that kind of falls back on the nurse. When you can't have a visitor there, you can't have people come in, or sometimes you can't even, people don't have the availability to do video chats or telephone calls or that kind of stuff. So that support person role falls back on the nurse a lot more than it did prior, when we could have, people come in and it was easier to have those kind of things happen.
Yeah, definitely. And, also, not just from your own perspective, but from a nursing supervisor perspective, I'm just curious, as someone who's working with the other nurses, how do you think that it might change, nurses who are just coming into the field right now? I have a friend who really just started her nursing career, and I can't imagine, having the coronavirus pandemic be your very first experience. I'm just curious if you have thoughts on that.
Sure. It's kind of hard to say how it's going to change those things as it sits right now. I think the new nurses that are coming in are having to deal with a lot more stuff than when I had to come in and be a new nurse. It's maybe a little bit more kind of in your face, because it's all over the media. Everyone's talking about it, and then you're going in and, you're kind of having to deal with these things.
Yeah, I can definitely think that's a challenge for sure. And kind of just segueing into my next question, which was about the fact that this is, you are in the media a lot as frontline healthcare workers, and so I just wanted to talk about people using the word hero to call healthcare workers heroes. And obviously, I mean, it makes total sense, because what you're doing is incredible and really important. But, I've also heard other people say that they don't want to be called heroes because, they didn't want to get put in this position of serving during a pandemic, and, sometimes without enough PPE or, other challenges like that. So I'm wondering, what the word hero means to you now when it's applied to yourself and applied to your coworkers.
Sure. And I guess I don't like to use that word, or I don't like being thought of in that way. A lot of people are out there doing jobs in the midst of this and putting themselves at risk too. This is a job that we had signed up for. We knew that there were going to be risks and that kind of stuff involved when we signed up for it. I can see that point of view from a lot of these big metropolitan areas where they don't have enough PPE, where that could put you in a little bit different point of mind than what I have. I'm fortunate at Bellin to have enough PPE so that I can feel safe when I'm taking care of these patients. I feel like I'm being able to take care of these patients in a safe manner. I don't know that it's appropriate to call everyone a hero. I think we're just kind of doing our job and doing the best we can to kind of get through this, just like everyone else is.
Yeah, that does make sense. And then my final question for you then, just to end on a little bit of a positive note is, obviously this has been really tough in many ways for many people, but like you said, there are also, you get to see the bright spots and, you get to see people going home and beating this virus. And, I'm just wondering at the end of the day, the end of the week, things like that, what keeps you going?
It really comes down to the patients and my coworkers. We have a great team that we work with, and throughout this whole ordeal, everyone's pulled together. And if we need extra help, we get extra help. And I just really have a great team, and everyone's kind of on the same page that we're going to get through this. We're going to get through it together. We're going to do what we have to do to get through it. And being able to see those patients that come in having the worst day of their lives, and you're able to take care of them in a way that changes their life and gets them back out there doing the things that they want to be doing with the people that they want to be doing them with. That's really what keeps you going.
Yeah, absolutely. Well, thank you so much, Adam, for this interview, and then also for all of your hard work and your sacrifices during this time, and for all of your coworkers' hard work and sacrifices. I can't imagine what it's like, but I'm really glad that you were willing to share your experience with us to help us understand a little bit of what it takes. So I really appreciate that. And this show will be back in 2 weeks on June 10th with another Newsmakers interview. But you can always keep up with our COVID-19 coverage on our 10 Gannett sites, and also by tuning in to our 5 and 5 rundown, which is just a quick rundown of the day's top headlines having to do with coronavirus, which happens every day at 3 p.m. But till I see you all again, I hope you stay safe and healthy. Have a great day, and thanks for watching.